showing up and learning more about this upcoming training we have this spring. So I'm going to do just a couple of brief housekeeping announcements and then turn the presentation over to Dr. Siegel, kind of give some background about this training, and then we'll kind of do some more, you know, how do I register for this training kind of stuff. Let's advance this slide. All right, so we really hope you all ask questions during the presentation. This is going to be really informal. It's a little bit different of a training we're doing, so that's why we're having this kind of webinar info call, if you will. So please ask your questions, and we'll get to those as they come up. I wanted to mention that there's there is a handout that you can download on your screen, and we'll actually look at that here later in the presentation. But there is a handout available for you to download. It has all the information on when and where this training is. And since this is just an informational webinar, we're not awarding any CEUs. It's just informational. So that's all I got. I'll kind of turn it over to Dr. Siegel.
Hi, Ben Siegel here. I'm excited to talk to you all about this special TF-CBT training opportunity that we're offering through ARBEST. Those of you that know me know that problematic sexual behavior is a particular interest of mine, and I've been wanting to offer more training and more support for kids with problematic sexual behaviors for quite a while, and I'm glad we're able to do that. So I'm going to talk for a little bit around you know, why we're offering this training, sort of a little bit background on children with problematic sexual behaviors, why we're offering it, how it's related to TF-CBT. I'll talk about some prerequisites and to attend the training, eligibility kinds of things, and then just kind of a brief overview about what training is. And then Chad will talk about logistics on how to sign up for the training, and then we'll have some questions and answers afterwards. So children with PSB, problematic sexual behaviors. And for the training and what I'll be talking about today, we're really talking about children 12 and under who engage in behaviors that involve sexual body parts or private parts. It could be, you know, buttocks or genitals. It could be hands or mouth or involve other kinds of things, but sort of behaviors that relate to sexual body parts. We consider sexual behavior problematic if it's potentially harmful to that child or other children, or if it's developmentally inappropriate or unexpected. There are numerous reasons why kids develop problematic sexual behavior, from simple curiosity, wanting to know more about sex and private parts, kiddos being impulsive, not having good boundaries in general, some kids possibly with social skills deficits, not understanding how their behaviors may impact others or picking up on social cues. Some kids may have been sexually abused or exposed to sexuality. You know, of course, these are things that we'll talk much more in depth when we do the training, but I just want to give you some background. There are also a lot of myths and misperceptions related to children with PSB, related to treatment, outcomes, and so forth. There's a strong myth that, you know, kids with problematic sexual behaviors will continue to have those difficulties and become, you know, adult sex offenders, and that really is a myth. We have effective treatments, outpatient, community-based treatments that are short-term, that have tremendous success rates. You know, there's also misperceptions about safety of kids with PSB. You know, can they be treated on an outpatient basis? Can they remain in schools? Can they remain in the home? All of these things are, you know, important to realize that, you know, there is stigma around this population, and there are views. But in reality, you know, what we know from research and outcomes, it's quite a different story. That these are kids, they're kids first, and the sexual behavior is a behavior, and we treat it like a behavior along with other things. So kids with PSB, they can develop or have PSB for a variety of reasons. Some have trauma histories and some do not. There are quite a few kids, significant proportion of kids that don't have a trauma history that develop problematic sexual behaviors. But there also is a significant proportion of kids that do have trauma histories. Could be sexual abuse, could be exposure to sexuality, domestic violence, separation from caregivers, all of which we know that trauma has an impact on a lot of different things, and trauma can be a risk factor to developing problematic sexual behaviors. And so we often see kids with trauma histories, with PTSD symptoms, and problematic sexual behaviors. So there is effective treatment for treating kids with PSB. And in fact, trauma-focused cognitive behavioral therapy, TF-CBT, is considered an evidence-based treatment for treating children with problematic sexual behavior when their problematic sexual behavior is trauma-related. Meaning that within TF-CBT, if a child has problematic sexual behavior, we're treating within TF-CBT that it's related to their trauma history and trauma symptoms, and we treat the PSB under the umbrella or the context of trauma. However, and I will admit it, I do training, and I think me, like other trainers in TF-CBT, we may not do as good of a job as we like to in our introductory trainings and in covering how to support trainees, clinicians, TF-CBT therapists on how to address problematic sexual behaviors within our training process. It kind of is a training case-by-case kind of thing, that sometimes we have cases that are involved with trauma-related PSB, sometimes not. And so this training was developed myself and a couple other folks from the University of Oklahoma Health Sciences Center and the National Sexual Behavior of Youth, along with the TF-CBT developers, Tony, Esther, and Judy, really do help people who have been trained in TF-CBT address problematic sexual behavior within TF-CBT. And so the consensus among us was that we needed additional support for people to effectively treat problematic sexual behaviors within TF-CBT. And so that leads us to, we are now offering that training that was developed and designed with me and others in collaboration with the treatment developers to be sort of a special opportunity, advanced training in TF-CBT with support around when kids have trauma-related PSB, how can we treat that within TF-CBT? So this training opportunity will be for children 12 and under. It will involve a day-long training, which will be led by me. I am a TF-CBT trainer. I also am a national trainer in an evidence-based model for treating kids with PSB, problematic sexual behavior, cognitive behavioral therapy, PSB-CBT. And so that is my background. I'm not providing training in that model. I'm not providing, or this is not to support TF-CBT therapists or you all on the call and others to provide PSB treatment, a standalone PSB treatment. That's not what this training is. This training is designed for people that are comfortable with TF-CBT when a child has PSB that are trauma-related, how to address that within TF-CBT. So it'll be a day-long training. We'll go over the content in a moment and eligibility requirements. Following that in-person training, there will be consultation calls, similar to what we did in introductory training. You'll be on a group of fellow clinicians, therapists, mental health professionals, where we will have once-a-month calls for 6 months, designed to, once you have this knowledge and background, talk about the cases that you're seeing with problematic sexual behaviors within TF-CBT. So what the training will look like. There is some pre-work, we'll talk about that in a moment, but the first sort of third of the in-person training, we will be talking about background about sexual behavior, what is typically developmentally expected sexual behavior, because kids do develop sexually, just as like they develop socially, emotionally, behaviorally, physically. Kids do learn about sex and they have questions. They may engage in age-appropriate sex play. We'll define that. We'll talk about that. We'll talk about how that is different than problematic sexual behavior and where those behaviors come from. What are the origins? When kids come in for treatment for PSB, what else is going on? We'll talk about some of those myths, misperceptions. What is evidence-based treatment? What do recidivism rates and things like that look like for kids 12 and under? We'll spend a good portion of the day talking about how to assess trauma in TSB and how do we make clinical decisions on, is this a TF-CBT case? Or is this a case that might need to be referred out or referred to a provider that is comfortable treating TSB without trauma? So talking about that. And then if TF-CBT is the focus or the treatment, what might we need to do within TF-CBT to address those problematic sexual behaviors? So half the training, a little bit more of the afternoon, we'll be going through each TF-CBT component and where would we add in pieces, content related to problematic sexual behavior. So we are treating both trauma symptoms and the PSB within TF-CBT. So we'll go through each component and talk through that. So eligibility. This really is a special training. It is different than our typical advanced trainings that we have. So it is a limited audience. And this is straight from the TF-CBT developers. We want to make sure the best we can that people that attend really know basic TF-CBT. And so the prerequisites, eligibility, you've had to have finished all aspects of TF-CBT training. So that's the web-based training, that's the in-person training, that's consultation calls. After that, or during that process, to be eligible, you have to have completed 3 full cases. So start to end, successful graduation, you've done TF-CBT, you've done all components with at least 3 cases. Using standardized assessment measures, the CATS, the UCLA, something like that to assess treatment progress, and 2 of those 3 cases have to have active caregiver involvement. So those are the prerequisites, that you've at least finished 3 cases, you have caregiver involvement, and you use standardized assessment, and of course, in addition to completing your full TF-CBT training process. So the training is on April 30th next year. I can't believe we're talking about 2020 already. It'll be 8 to 4. It'll be Camp Aldersgate in Little Rock. I will be doing the training. There will be CEU 6. Cost is free. There will be 45 available slots. Registration will open December 16th. Chad is going to talk about the process for that in a moment. I hope you will consider coming. We'll have a question and answer after talking about a little bit more about the logistics.
All right. Thanks, Ben. So where do we want to start? So we'll just kind of basically how to register. This might be a little bit different for some of you who have registered for one of our TF-CBT trainings. And so we're going to get on a training page that we have a development site for, so you can see what that process looks like. And that might be easier just to show you what it looks like than, kind of reading this verbatim. I think it might be a good idea, if you haven't found the handout now, see if this works and if y'all can see what I see. Great. So hopefully you're seeing the kind of the PDF copy of the handout that is available for you to download. And as I mentioned earlier, this sort of has all those stats. This is just a great, I would save and keep this just so you're kind of clear on what the eligibility and the steps for this. If you're attending and one of your friends couldn't, this is a good thing to kind of pass along to them. So this just has kind of all the information in one place. So I'm going to kind of jump on our training page here. See this. All right. So this is in our live website, but just so you all kind of get an idea of what the steps you'll need to do. So this is your home page here, and when registration opens on December 16th, you'll need to navigate towards the training tab. And then up here in this upcoming section, you should see the training we're talking about today. And then this is where you'd actually go to start your registration. So all the description and stuff is here that's on the handout. The kind of the important thing, or the steps that might be a little bit different, is you're going to need to upload an attestation form, which is this document thing here, before you can even register. Like, you'll notice it says not all prerequisites met. You won't even be able to register until Gail or myself have kind of looked at that document and approved it. So hopefully it'll come up here and you can see what it looks like. So this is sort of exactly what Ben just went through on the eligibility requirements, and plus a little bit more information on kind of what's expected, once you have been registered. So you are attesting that you've completed the TF-CBT training, which we know, and we can kind of verify that. And we'll kind of double check that you have completed all those parts, and that you also are attesting that you've completed those 3 TF-CBT cases. So once we've approved this document, what will happen is you'll get an email saying, hey, this document's been approved. You will need to go back in to your ARBEST account, back up here, and then this will become a registration link, and you'll need to register that way. So you sign the attestation form, you upload it here, and we will approve it. I would say give a 24 to 48 hour turnaround for us to approve these documents. And you'll receive an email that says, hey, we reviewed this document, go back in and actually register for this training. So, and if you have any other questions about that process, feel free to reach out to myself or Gail. So that's kind of the different thing. And then I'll kind of look at this again. Once we kind of have the group of folks for this training, Gail's going to be sending a couple other things your way, sort of this pre-work that Ben mentioned. So there's going to be a survey kind of to help us to get to know the group, some pre-readings, et cetera. They're outlined here in this attestation form. So when you actually register and you get that confirmation email that you're registered for the training, just be on the lookout for that email. It probably won't come immediately because we'll want to kind of get a group of folks, together versus sending out individual emails all the time. So just be looking for that. And I think that's all I have on this scale. Am I missing anything? Okay, so I'm going to jump back here. I think that's it. So let me go back to this, minimize this. Okay. So registration opens December 16th. Go to your training tab. Then you're going to select that TF-CBT for PSB training. You need to download that attestation form, complete it, scan it. You can take a picture of it, upload it. And then number 3 is really important. What I just kind of mentioned there is once that's approved, you need to go back in and register. So just because you upload your attestation form does not mean you're registered for the training. Because again, like Gail and myself, we have to verify that you've completed all those parts of your TF-CBT training. So, and that's pretty quick for us to do. If you have a special case, like you completed your training in Indiana or something, and not necessarily with us, please just let Gail or myself know, and we can handle those case by case. So. And then once you actually are registered for the training, you'll get sent some more stuff, some pre-work, so before the actual day of the training. So if you have questions, please type those in. Gail's going to be the best person to get your questions answered quickly, so her contact information is up there. So type in those questions. I know Lisa asked a question earlier, and maybe, I don't know if we've already addressed it, but Lisa asked, does 3 TF-CBT cases have to be discussed in the consultation calls. What if you only completed 2 TF-CBT cases on the consultation calls? I know Benny kind of mentioned that earlier, but.
Yeah, and so the 3 cases, it's separate of your training process. So, for example, if you're a real go-getter and you had a ton of cases when you're doing your calls and you had finished 3 cases during those calls, great, you'd be eligible. If you didn't, you finished 1, you present your cases, you could then finish 3 cases a year, 2, 3 years later. As long as you've completed 3 full cases, you contend and you're eligible. We do not need sort of documentation or information of the clients. It is on your honor. You just have to attest that you have completed 3 cases, full TF-CBT cases.
Please, if you have a follow-up question about that, please type that in. Christy asks, will there be a limited amount of slots available for each agency? And I'm going to say no on that. So we do have 45 slots available. It is kind of a first come, first serve, but I guess I would, if you're going to send like a group of folks from your agency or, 3 of you from your group want to come, I would try to send your attestation forms in together and maybe even give Gail a heads up. We can't save any spots, so it is kind of a first come, first serve. And we approve those attestation forms as they come in. So, and we usually do that like on a daily basis unless there's like a holiday or, one of us is out sick. So,
and I think also, related to sort of if you're from a larger agency and you want to send several people, it is most helpful for people who have access to cases that have problematic sexual behaviors and certainly access to kids with PTSD symptoms that you're doing TF-CBT, because a lot of the information in the calls is much more applicable for people that have those cases already.
Good question, Christy. Then that kind of reminds me, do you want to talk a little bit more about the consultation calls with these and just kind of restate that, like what that looks like?
And so the consultation calls, they're going to be similar to sort of the introductory training process for TF-CBT. There are a couple sort of standard things I like to do on the calls, go over a couple things that we typically don't have enough time within the in-person training to go over. So I'll typically go over sort of safety planning, visitation, reunification kinds of things for those cases that because of the problematic sexual behavior or other reasons, kids have been separated, and so balancing when's it appropriate to start reunification and what that safety planning needs to look like. So that's usually a topic I will talk about on the consultation calls. We'll also spend more time on managing trauma narration, because an activity that we typically do with some kids, typically kids 7 and up, sort of the apology letter kind of activity where the child talks about when they broke the sexual behavior rules, sort of skills they've learned to sort of, not have that happen again. And sometimes that is done within the context of trauma narration. Sometimes it's done as a separate activity. So we typically spend a little bit more time on that. I typically do a couple of my own case presentations. But then the rest of it is just questions that people have, case presentations like we do normally, sometimes scheduled, usually not, just checking in with people, how their TF-CBT is going for their trauma-related PSB cases. And I do want to stress, it is for kids 12 and under, so we are talking, 12 and under, so within that age range where it's appropriate for TF-CBT, so 3 to 12. A lot of people ask questions, well, what about adolescence and when's that coming? That is an area that we're going to be focusing on with the treatment developers shortly. We wanted to start with kids 12 and under. So we really are talking about those kids first, and hopefully we can offer training later for kids 13 and up.
I just had a question, but I lost it. Yeah, so this is meant to sort of any other feedback or questions that you all have. I think, oh, I know what it was. I mean, I don't know if we have anybody on the webinar that's in this situation, but what if you're currently participating on TF-CBT calls now? Your calls will be complete by April. Should you sign up for this? And I think I'm going to give the response first would be we really want kind of folks who have some TF-CBT experience under their belts. But again, if there's like a special situation where this is like the population you work with and stuff, like that's where you can, you know, email Gail. Ben, do you have anything to add to that, or?
Yeah, I mean, we can be somewhat flexible, really keeping in mind that I think somewhat more importantly is finishing those 3 cases. You will have to be done with consultation calls by the time you attend, but having that foundational knowledge of TF-CBT and that case experience, that's the one I'm going to be more firm on. You will have to get through calls, but as long as you've got those cases, or you're really on track because you have a caseload of 10 TF-CBT cases and you're making good progress, then we can be more flexible that it really looks like you're going to finish 3 cases by the time you start.
Yeah, and just so, I mean, in case others have friends or if you're in that situation, usually what we'll do then is we'll kind of get with the trainer or the consultation call leader of your call and just kind of do a check-in, like, hey, you know, this so-and-so wants to register for this training, like, how are they doing? And so that's kind of what we do on our end to sort of like figure those things out. So just to kind of be transparent about this. All right,
Yeah, just one more, and I said this earlier, but just so we're as transparent, as clear as possible, this is a TF-CBT training. It's an advanced TF-CBT training. It's a special opportunity that we're doing through ARBEST. It's support within your TF-CBT to address PSB when they're trauma related. So just want to be clear on that. This is not a different model. This is not a new model. This is also not training in treatment that is not TF-CBT. So this is just for those cases that we treat within TF-CBT.
Yeah. So if you joined a few minutes late, I mentioned earlier that no CEUs are being awarded for this webinar. It's just for informational purposes. If you have other questions, feel free to write those or type those into Gail. And registration opens December 16th. So with that, I think we'll kind of end it.
Yep, and will this be posted on the YouTube channel if people weren't able to attend, that they could?
Sure, we can post it. Yeah. So yeah, if you're watching this at YouTube, hopefully you will join us for our TF-CBT training on TSB this spring. So.
All right. Well, thank you. I hope all of you will join us for our training in April.